a voice of encouragement to encourage you in scriptures. Let's get started. Well, God bless you, ladies and gentlemen. Amen. That's right. We're the voice of Prophet and Desert, the senior pastor of the Promised Land Community Church. And this is the week where we're talking about your wealth is your health. And we have the team here today, and we're so excited, amen, about being able to take up on this new challenge as being life coaches for type 2 diabetes prevention. And we have in the studio, we have our known nurse Rowena. She's been practicing nursing for over 50 years, and she's a public health consultant. And we have also to my right, we have Sister Shalonda. She's also a professional. She's a fitness trainer, as well so physical therapist, as well so nutritionist, as well so into our right left, we have our own Dr. Remington. She is a clinical doctor, as well so her expertise is diabetes. So she covers every aspect of diabetes, and she's assisting and helping us as we move forward in this journey. And we're going to move forward today, and we want to start with Sister Miss Nurse Rowena. Tell us, how are we going to talk about this today?
Good morning, Pastor. Good morning, radio audience. We're so delighted to be here today.
Yes.
We're just excited because we know we're up to the Father's business.
Yes.
Today is day 3 of a 4-part series where we're talking about your health is your wealth.
Yes.
And part 1 was, we started out by talking about it's all in your head. Because if the head's right, the body will follow.
Right. Mm-hmm.
Then we went to talk about how does your body work. If you don't understand how your body works, you cannot make a change for the better.
That's right.
Because you have to understand how it works. And then today we're going to be talking with Dr. Remington, and she's going to be speaking about nutrition and a few other things, hopefully. And one of her really big things is that she does a beautiful teaching. Working with a PharmD is, as far as I'm concerned, the doctor of choice.
All right,
because they teach, they cajole, they move you along. I have known Dr. Remington now for several years, and I've known her to be an absolute professional, and she does the body good. She does a great job in teaching, and she has a wonderful program where she actually teaches people about medications and how it works with the body. Number 5 is going to be 5 ways to make your body work. An exciting week, and we hope you're going to enjoy yourself. Dr. Remington, welcome to the show. It's all yours.
Thank you for having me. Okay, so as you know, let me just give a little bit of background. So my name is Dr. Remington Jr. I am a clinical pharmacist who specializes in diabetes medication management and diabetes medication management and diabetes care and education. So I have 2 certifications. One is in drug therapy. The other one is in diabetes education. I'm here to talk to you today about how nutrition makes a difference.
Yes.
So just to give a couple pointers, we know this kind of thing. So healthy eating has a significant effect on controlling diabetes, controlling our blood pressure, making sure it's at our target rate, and also helping us lose weight or to maintain weight loss. Healthy eating also involves healthy behaviors and healthy decisions, such as knowing when to eat, what to eat, how much to eat. As we know, we've been talking about the diabetes prevention program. It's a program pushed by the CDC, and it has showed strong evidence that interventions like lifestyle, like physical activity, can actually reduce your risk of diabetes, even more so than medications alone. Technically, it says it has a 2 times effect as medication in preventing diabetes. So let me just give you a couple of stats for the diabetes prevention program, because this is a lifestyle program that focuses on diet, correct food choices, and also physical activity. After 10 years of intensive lifestyle changes, the diabetes prevention program states that you can reduce your rate of type 2 diabetes by 34%. Within 15 years, it can decrease your rate by up to 27%, but there's other studies that say that between 20 and 25 years, the rate of decrease of your risk of type 2 diabetes can be up to 43%. So that's a significant difference with us just making sure that we're having healthy food choices and maintaining an active lifestyle.
That would give us our why.
Our why?
That would give us our why.
Yes.
You just gave us the why.
Right.
Yes, and as we get older, I'll say this, quality of life is something that's very important, and that we want to make sure that we stay active. We want to make sure we stay mobile because we want to actually have those or create those moments and have those moments with our families and with our friends so that we can be active and social with, with our community. So the goal for the diabetes prevention program states that if you reduce your total body weight by at least 7%, then you could obtain these percent reductions to reduce your risk of type 2 diabetes. And to obtain that, really what it comes down to is calorie restriction and increasing your physical activity. So how do we start?
Yes. How do we start?
Well, first we need to ask for help.
Okay.
All right, so we can do that by, speaking to our provider or our primary care manager or our PCP. So if you have been diagnosed as having prediabetes or if you're concerned about your A1C creeping up, talk to your physician and ask if you could receive something what's called medical nutrition therapy. And so most insurances will pay for it. It's a referral service where you can go and see a nutritionist. And they will provide you some guidelines on how to prepare and plan your meals. This is not a diet. What it is, it's called a food plan, a meal plan, and it's a way for you to change your thinking on the calories that you consume. Because what we want nutrition-dense food.
Nutrition-dense food, and when you say nutrition, break that down in layman's terms.
So we're looking for foods that are high in nutrition, high in minerals, high in protein, carbohydrates, and low in fat.
Okay.
And the reason why I say high in protein and carbs and low in fat is because fat per gram has more calories than carbohydrates and protein. So this is a side, but 1 gram of fat is 9 calories. 1 gram of carbohydrates, 1 gram of protein is 4 calories. So you can see that fat is almost double the amount of calories than carbs and protein.
Would that be the difference between a Twinkie and a slice of avocado?
Yes, it would be the difference, even though they both have some type of fat. What we're breaking down, and this is like a whole nother subject, is like the type of fat. And there's such things as healthy fats that are heart healthy. And our avocado is definitely heart healthy.
I want to ask you a quick question here, if you don't mind here. I had an experience today with a young man, 56 years old, just a brief. He's in the place getting ready to do a blood test because the doctor told him his glucose level is really high. He needs to check this out. But as we was talking about changing his habit of eating, it's like I ran into a brick wall because he ran into I've been eating this way for, I've been doing this way. How do we penetrate that? And in your experience as a doctor, and this is your expertise, how have you handled those situations when it deals with the mental and the mind of those individuals having a hard time making those life changes?
So, really, there's a behavior health model called the transthetical behavior model of change. And essentially you assess a person and see where they are in the process of behavior change. So a good portion, if they're stuck in one of those processes, the best thing as a pharmacist or any other provider can do is provide education. Because a person's not able to move through each step if they're not ready. But education and patience can help people make decisions. Another thing would just be, just to recommend them tracking their food, which is something I'm going to talk about.
Okay.
And so tracking your food will allow you to know what you're eating versus what you think you're eating. And that comes down to looking at your carbs, looking at your protein, looking at your vegetables, looking at your calorie intake, because, we might think we're on a low calorie diet, but we really aren't on a low calorie diet. And then also going over nutrition labels, so those are some things that I have done personally. And all that comes down to educating the patient.
And I think that comes through the training that we're
That's
pursuing
what we
right
do.
now.
That's
Because even you just spoke about something exactly. I remember being in one of the books that we had and dealing with those areas of moving past the areas of where they're struggling.
Yeah.
And I know for myself, I was drug in it the second time, but I really got it and understood the value of the information. And I think you're so on point with bringing, because I know for myself, understanding calorie, understanding calorie intake, and understanding sometimes people go to the store, they buy, low carbs, and they're low carbs, and they buy all of this stuff and put it in the thing and feel like they're eating healthy. So what would you guys say to that?
Well, it's part of the education process.
Okay.
It's a process because it's not a 50-yard dash. It's a marathon.
Right.
And one of the things that we tell people is if you take the time to read the labels, because if it says low calorie, that means they've taken out some fat and replaced it with sugar
Or salt.
or salt.
Okay.
And that's the way the manufacturers do to get you across the line of saying it's low calorie.
Well, even the amount per serving that's on those nutritional labels is another big factor to look at, and we teach you how to do that in the program as well.
Okay.
And then fat is good. We need fat for certain production of hormones in our body, right?
Okay.
So the question is how much fat and what types of fat, because
So
we have
what kind of fats would be good fats?
poly and monosaturated fat. Monosaturated fats. Saturated fats are the fats, and trans
saturated
fats are the
fats.
fats we want to stay away from. I mean, we're going to eat them, but you want to have them in moderation.
How about Doritos?
You got salt.
Well,
I don't tell people not to eat what they like.
Okay.
I manage type patients with type 2 diabetes, and I just say moderation is key.
Okay.
And so it is a lifestyle change, but it's very hard to adhere to a diet that you don't like.
Right.
And some people are
That's good. That's
have
good.
happiness in the foods that they eat, and
Right.
food is also like a social construct.
Yeah, that's true.
So it really comes down to moderation.
Okay.
so would you say maybe just pairing some like whole foods with some of those snacky foods might be a good balance? Like, would you advise some of your patients to do things like that?
I like taco salads.
Okay.
Yeah.
So you can have Doritos as the chips,
Okay.
and then
Yes.
get like some turkey, ground turkey.
Okay.
You could put you make your own tomato avocado
Yes.
salsa with black
Yes.
beans. Put it on
Oh, yeah.
top.
So we're here to help you get creative.
Yeah, just this last weekend, I did this. Instead of using sour cream, I used Greek yogurt.
Well, that's different.
Put in some cilantro, some lime, blended it up. Very delicious. So there are a lot of things that you could use to substitute things that are high in fat for things that are lower in fat and higher in protein, like sour cream versus Greek yogurt.
Oh, wow.
It's those baby steps. It's those baby steps, and those are good ways to segue, right?
Right. So we're now at the topic of what to eat, right? So this is a good segue. So there's really no set diet. We're not looking at low cal, low carb. We're looking at something that is reasonable and that is realistic, but that has, a good amount of vegetables, proteins, and fats. This is not a diet. This is a food plan. Or a meal plan. And if you have access to medical nutrition therapy, you and your nutritionist will create a meal plan that suit to your needs and your likings. So we want to choose foods, and these are general terms, our general requirements, foods that are low in calories, because if we want to lose weight, which we'll talk about, we need to have a diet lower in calories. We're not looking at a calorie restrictive diet, but we do need to eat less calories to lose weight. We want something low in fat, and we mention that because per gram fat has more calories than protein and carbohydrates. We want something low in sugar, or we want to reduce the amount of added sugar that we eat every day. Sugar is good, especially if you have natural sugar sources like fruits, or honey, agave, stevia, things of that sort. But, it's the added sugar that is, problematic for us. Foods that are high in fiber. Fiber is something that makes us feel full. It aids in digestion. It helps lower glucose spikes after we eat.
So because we ran, I told you this was going to be a good one. I told y'all this was going to be
we're
a
out
good
of time?
one. We have run out of time.
no.
It was in Florida. Amen. We love you. Tune in tomorrow. We'll be back again tomorrow.
Yes.
Tune in tomorrow.
See you tomorrow.
Thank you, guys.
Hi, I'm Prophet Phillip Washington, the senior pastor of the Promised Land Community Church. Our location is 3646 North Las Vegas Boulevard, and we would like to invite you out to 2 services on Sunday morning. That's 9:30 and 11 o'clock. We also have our Wednesday night Bible study at 7 p.m. every second and fourth Friday of the month. We would like to invite you to our evangelistic service. The time of that service is at 7 p.m., and we would love to see you there. God bless you.